Hello, my name is Paul Gosney. I'm a specialist registrar in general adult psychiatry. I'll be talking to you today about the psychiatric history, mental state examination and risk assessment. Taking a psychiatric history and performing the mental state examination are fundamental to the practice of psychiatry. Psychiatry is almost unique in the degree to which we rely on the history and examination. People new to psychiatry often worry about the reliability of diagnosing people in this way without the use of special tests and investigations. However, there's good evidence that the inter-rater reliability of psychiatric diagnosis is good. This is the percentage agreement when two independent observers assess the same patient. It's comparable even to some medical diagnosis. The psychiatric history contains many elements which will be familiar to those practiced at taking a medical history. The major difference is the degree to which we inquire about the person and not just the illness. You can think of a mental state examination as a structured sketch of the patient. A competent clinician will weave the mental state examination through their psychiatric history, but at first you may find yourself asking separate questions to cover areas such as mood and thought, and this is acceptable. Ideally, every patient will have a physical examination at assessment, and this has two roles. The first to look for any physical causes of mental health problems, and the second to screen for any underlying physical health conditions which may influence our choice of medication. I can't stress enough the importance of a risk assessment every time you meet a patient. So you'll need to get comfortable with talking to patients about suicidality and thoughts of harming others. You should be aware that patients will be expecting these kind of questions, but still introduce the subject sensitively. The key skill in taking a psychiatric history is to take an adequate history whilst using language that's appropriate to the patient and building a comfortable rapport so that the patient can trust you. This can only be achieved by practicing with real people. Thank you.